Hi friends, welcome to Mother and Baby Matters new podcast. On May 11th, we have Mother's Day. A woman feels complete when she becomes a mother. And now, because of so many issues and lifestyle disorders, women are facing lots of issues when it comes to becoming mother. So today, on all these topics, we want to discuss with Dr. Shital Kasat. She is gynecologist at Thane Civil Hospital, and in her life, she doesn't know how many deliveries she must have done in her life, because she have lost the count also. On an average, a hospital, a gynec sees around minimum 10 to 15 cases. So we can't imagine how many cases she must have seen as of now in her last 30 years of services.
I am Dr. Shital Kasat. I am gynecologist at Thane Civil Hospital, and I am in government service since last 30 years.
So madam, tell us in medical terms, whom you consider a mother?
In a medical definition of mother, it's three parts are there. One legal mother, biological mother, and gestational mother. Biological mother is the one where her own ovum is used, get fertilized, and resulting in the conception of the baby. Gestational, it can be a biological mother also, and the surrogacy mother also, where the ovum is of another woman and just it is kept in another womb. And third is legal mother. She can be biological or adopted child or anything else.
Ma'am, why we are seeing more and more cases of fertility issues? Fertility rate is going down day by day in India, even in the world also. So what do you think is the problem behind this?
The main issue is lifestyle changes and the food habits. More and more kids are prefer for fast food, and that is the thing, but it has major effects in female as a PCOD and all that. In PCOD, she has a polycystic ovarian disease where her ovum, basically ovum production is affected, and she doesn't have regular menstrual cycle. So definitely it will affect the fertility of the patient. Because of career orientation and all that, female are getting late married and then they plan pregnancy late. So if they are having some issues with the fertilization, it again delay for the diagnosis and treatment. So that is the issue.
Why there is a late pregnancy planning, and what are the problems being faced by these women when they are planning pregnancy late?
See, the ideal age is for pregnancy is 20 to 30 years. By that time, she is physically mature, emotionally also mature. But before 20, she is not mature enough. But after 30, she may have her own medical issues, hypertension, diabetes, and all other issues. Even it seems the child issues are more there, like Down syndrome, mental retardation, and all that.
What type of problem a baby faces when a mother plans late pregnancy?
Like I already told, baby can be a Down syndrome baby or mentally retarded baby, and if patient has another medical issues like pregnancy, hypertension, or diabetes, so baby can have IUGR baby, intrauterine growth retardation, low birth weight, and another problem. Or with diabetes, the more weight of the baby can land up into cesarean section and hypoglycemia after the delivery.
So ma'am, you mentioned about C-section. So why there is an increasing trend of C-sections in India?
See, because of better facility and better health of the mother, the baby weight is definitely increased now. So, and also there is pain threshold is less, and even women and relatives are ready to go for the C-section. First they used to say कि नहीं normal ही करो. Now they are ready to कि नहीं हमको बच्चा safe चाहिए. We can go. So when the first used to do only for maternal indication like placenta previa or breech or something like that. But now we are going for fetal distress also, oligohydramnios. इसमें the water is low in the hair, and also there is a loop around the neck of the baby, cord loop, and that placenta previa and all that. So it is the thing.
How does the C-section affects the baby in future?
No, grossly it won't affect the baby in future, C-section. Some studies are says that he may have allergy or asthma, but not proven as such.
Okay. Coming back to C-section, what type of problems a woman may face when she delivers C-section?
Yeah, in C-section, woman can have many problems. First is immediate problem. She will definitely have more blood loss comparatively to normal delivery. She has to take more rest compared to normal delivery. And in some cases, there may be more problem like adhesions and inside wound infection is there. In long term, she may have asthma, hernia, and even scar endometriosis is there. And again, if once she goes under C-section in next delivery, again C-section is compulsory nowadays. That is it.
One more question related with this blood pressure problem, diabetic problems, asthma problems. If mother is having all these problems, does it also impact the future of the baby, or does the baby also can inherit these problems with him or her?
Yeah, definitely. Not immediately, but they are genetically predisposed to all these things. In late life, that baby can have all these problems.
So if mother is suffering from all these problems, so what type of problems she may face while delivering or completing her entire cycle of pregnancy, 9 months?
Yeah, she may end up in preterm delivery if the problem exaggerate, and there are many problems. Baby weight can be more in diabetes, C-section हो जाता है. In hypertension again, she may have convulsion, IUGR baby, and all that. So premature deliveries are more common with all these problems.
So ma'am, what are the problems a premature baby may face in future?
So there are two immediate problems is that baby may have hypothermia, won't maintain the temperature, susceptible to infection as premature and low birth weight baby, may have respiration problem, respiratory distress syndrome. There is immediate problem. In long term, he may have developmental delay, motor delay and all that, may suffer from asthma and allergic issue, may have learning disability in some children.
So doctor, nowadays we are seeing more and more numbers of IVF clinics coming up in cities and even rural areas. So what do you think, why this trend, and what is causing people to go for IVF and egg freezing?
Egg freezing is different thing. Egg freezing mainly the woman goes when she is under treatment for some cancer or like that, so she cannot plan pregnancy immediately, and she is crossing her age, so she can go for freezing the healthy egg before the treatment starts. And even like I said, career oriented women, they also thinking nowadays to preserve the healthy eggs for future when they plan the pregnancy. And IVF center, because like PCOD and all that increasing, so they're increasing the infertility rate. So definitely demand is there for IVF.
What is the success rate of IVF?
Nowadays success rate is really good, 40 to 40%, 45% if the age is less than 35, and in 35 to 40 it is around 35 to 40%. After 40 it definitely decreases.
What should be done if we want to have a normal delivery and not a full term baby? What precautions a mother should take?
Yeah, like government always say, early registration is good by jitna jaldi ho sake, by 12 weeks or 10 weeks, and then take all the precautions which have been said, regular iron and calcium, folic acid, do all the said test, sonography, rest, good high protein diet, that will regular blood pressure checkup and everything. Vaccinations. So that is.
Doctor, is the income of the pregnant women's family or pregnant women decides the preterm delivery, maternal mortality, infant mortality rate also?
Sadly, it is yes. It is proven by statistic also. Low socioeconomic, they suffer more from hypertension and anemia and all that. Definitely, I think education and it matters a lot.
So nowadays we all talk about diet. So what type of diet a pregnant women should have for a healthier pregnancy and healthier baby?
Yeah, like everyone says ki high protein diet. A typical Indian diet is really good. She should go for a home cooked food, green leafy vegetables, fruits, and definitely avoid smoking and alcohol, all that.
Now let's come to the topic of myth and facts.
Mm-hmm.
Is eating papaya during pregnancy is harmful for the women, mother as well as the child?
It is partially true. The unripe papaya, it may cause some irritation in the uterus. So better to avoid unripe papaya. But ripe papaya there is no problem.
Doctor, after all these discussions, if we want to let the pregnant women and vulnerable mothers, what precaution, what suggestions they should follow in nutshell, what would you like to say?
In a nutshell, I will say that a woman should plan her pregnancy before 30, after 20, definitely not before 20. And she should, before pregnancy only, when she is planning, she should have folic acid. She can go for folic acid daily, and healthy diet, proper rest, some exercise. And after she get conceived, go immediately. As soon as she knows that she is pregnant, she should register herself and follow all the instruction given by her RNA. That is the thing. Get all the vaccination.
Thank you, doctor, for giving such important messages and information that was authentic. There are so many of information available on the net, on YouTube, but that are not authentic. That's why at Mother and Baby Matters provide only those information which are authentic and with research and study. Then only we share it and post it on Mother and Baby Matters. Thank you, madam, for giving such information. Thanks a lot.
Thanks a lot.